The letter from my insurance company came in a plain white envelope. I almost threw it out unopened. I get a lot of mail from them. Explanations of benefits, statements I never read, marketing for services I don't need. This one looked like all the others. It wasn't. It was a notice that I had reached 80% of my annual out-of-pocket maximum for the calendar year. The letter recommended I contact my insurer if I had questions about my coverage going forward. I had questions because I'd been to the doctor exactly twice that year, once in February for a sinus infection, once in April for a follow-up. 2 appointments, maybe $400 total in billed services. There was no possible way I had spent my way to 80% of an out-of-pocket maximum that was set at $4,000. I called the insurance company that afternoon. The woman on the phone was patient. She pulled up my account and started reading the claims that had been submitted in my name over the previous 9 months. There were 41 of them. Office visits, lab work, diagnostic procedures, follow-up consultations, all from the same provider, all from a doctor I had seen exactly twice in my life. The dates of service spanned from January to October. Some weeks had 3 claims. 1 week had 5. I asked her to read the dates back to me again. I wrote them down on a notepad next to the phone. Then I pulled out my calendar and started checking. I had been at work on most of those dates. I had been on a flight on one of them. I had been at my mother's funeral on another. I had not been at the doctor's office, not once after April. The insurance representative told me I needed to file a formal fraud complaint. She said she could note the call in my file, but that she couldn't initiate the investigation herself. She gave me a number for the insurance company's special investigations unit and told me to call them in the morning. I didn't sleep that night. I sat at my kitchen table with my calendar and the list of claim dates and tried to understand what I was looking at. 41 fake appointments, each one billed at somewhere between $200 and $800, depending on the service code. The total amount billed in my name was somewhere north of $14,000. I'd paid co-pays on the 2 real visits. I'd never paid anything else. The claims had all been submitted directly to insurance and paid directly to the doctor. I'd never seen a bill because there was nothing for me to pay. The insurance was covering it. The only reason I'd noticed at all was because the claims had finally added up to enough that I'd hit a threshold the insurance company was required to notify me about. I called the Special Investigations Unit the next morning. The investigator I spoke to was not surprised. She told me this kind of fraud was more common than people realized, and that it was usually discovered exactly the way I had discovered it. Through a routine notification, months or years after it had started, she asked me to do 3 things. First, request my full claims history from the insurance company in writing. Second, request the medical records from the doctor's office for every date of service on the claims. Third, do not contact the doctor's office about the discrepancy. She told me explicitly not to call them, not to send a letter, not to ask any questions. The investigation needed time, and any contact from me would tip them off. I did the first 2. I waited. The claims history came back in a week, 41 claims, exactly as the representative had read to me. The medical records took longer, almost a month. When they arrived, they were more disturbing than I expected. There were notes for every appointment, detailed notes, vital signs, symptoms, examinations performed, treatments recommended. They described conversations I had never had, complaints I had never made, conditions I had never been diagnosed with. According to the records, I had been treated for chronic back pain, anxiety, recurring headaches, and a mild but persistent gastrointestinal condition over a period of 9 months. None of it was true. All of it was documented in clinical detail, in what looked like contemporaneous notes from a physician who had seen me dozens of times. Whoever had done this had not just submitted fake bills, they had created a fake medical history. I sent the records and the claims history to the investigator. She told me they were exactly what she'd been hoping to see, and that the volume of documentation actually made the case stronger, not weaker. People who fabricated this much detail usually fabricated it for many patients, not just one. Patterns emerged when investigators had something to compare across files. She told me she couldn't share details of the investigation, but she would let me know when there was an outcome. The outcome took 8 months. In the meantime, I changed insurance providers when my annual enrollment came around, and I switched to a new primary care doctor. I didn't tell the old office I was leaving. I just stopped going. I don't know if they noticed. The investigator called me in October of the following year. She told me the case had concluded and that the doctor's practice was being referred for criminal prosecution. The investigation had identified more than 400 patients with fraudulent claims filed in their names. The total amount billed across all patients was over $2 million. The scheme had worked like this. The doctor, or more accurately, his billing manager, who turned out to be his sister-in-law, had been pulling patient files at random and submitting claims for appointments that had never occurred. They'd targeted patients who had insurance plans with high reimbursement rates and who didn't visit the office often. The logic was that infrequent patients wouldn't notice the claims, and even if they did, the practice could plausibly claim a clerical error and refund the small number of complaints that came in. The sister-in-law had been doing it for almost 6 years. She'd been generating fake clinical notes to support the claims using a template she'd built from real notes the doctor had written for other patients. She'd been so consistent and so detailed that the insurance company's automated review systems had never flagged anything. What had finally caught her was me, or more specifically, the threshold notification that had gone out automatically when my fake claims pushed me past 80% of my out-of-pocket max. Most of her targets had higher maxes or had real medical expenses that made the fake ones blend in. I'd been an outlier, a young, healthy patient with very few real claims and a low cumulative threshold. The system had flagged me. The system had not flagged anyone else. The criminal case against the sister-in-law moved forward. She pled guilty to multiple counts of healthcare fraud and was sentenced to 4 years in federal prison and ordered to pay restitution she would never be able to afford. The doctor was a more complicated case. The investigation found no direct evidence that he'd known about the scheme, but it also found that he'd been receiving the deposits from the fraudulent claims into his practice's account for 6 years and had never questioned the volume. The state medical board suspended his license pending review. He surrendered it voluntarily 6 months later rather than fight the proceeding. His practice closed. I got a settlement from the insurance company, not a large one. The fraud hadn't cost me money directly, since I hadn't paid the claims myself. But the company agreed to expunge the false medical history from my records, to issue a corrected claims history to any future insurer, and to compensate me for the time I'd spent dealing with the investigation. The amount wasn't life-changing. It covered the cost of the lawyer I'd hired to make sure the medical records were actually deleted, with a little left over. The thing that stayed with me wasn't the money or the case, it was the medical records. 9 months of detailed clinical notes describing a person who didn't exist, symptoms I'd never had, conversations I'd never been part of, a whole shadow version of my health sitting in a database, treated as fact by anyone who pulled the file. I think about that sometimes when I fill out a new patient form. The questions about my medical history, the boxes I check, the assumption built into the entire system that the records are real because they're in the system. I check my insurance statements every month now. Every single one. I read every line. If this story hit you, subscribe. Every case on this channel starts with trust and ends with